what is the scenario of kidney problems in India, and what do you think are the most common risk factors which you come across, Dr. Vijay Kher, sir?
850 million people have some form of kidney disease across the world at this point of time. 850 million people. You can see the enormity of the prevalence of chronic kidney disease. In India, 1 in 10 people is suspected to have some form of kidney disease, which would mean we will have 130 million people at least who have some form of kidney disease. So you can see it is the 8th most common cause of death at this point of time in India. And the way it is growing, it is going to be the 5th cause of death in India. Dr. Chopra, your awareness program, along with other colleagues, has decreased cardiovascular disease worldwide as well as in India as a cause. Although it still remains number 1 cause of death, but it is decreased as far as the last 10 years. Global burden of disease shows that there is a decline. The 2 diseases which have increased in India are diabetes and chronic kidney disease. And you were just saying that there is an epidemic, and unfortunately we hold the title of having the largest number of diabetics in the world, and India becomes the sort of diabetic capital of the world, which is not something that you and I should be very proud of. We need to be taking care of reducing the incidence of diabetes and kidney. So the commonest causes of this increasing burden is diabetes, number 1 risk factor for development of kidney disease. Second most common cause, hypertension. And then there is a host of other diseases like glomerulonephritis, which is kidneys are consists of the filtering units which are called glomeruli, and we have about 1 million in each of our kidney, and this gets inflamed by an immunological process, an autoimmune process, and that is another cause of kidney disease. Then in addition, there is stone disease, urinary tract infections, and some congenital diseases like polycystic kidney disease and others, also less common diseases. But drugs become again another important cause of chronic kidney disease. And in India, we are very commonly using drugs over the counter. We go to the chemist and buy drugs like gas medicines, the painkillers and others. For every small reason, we go to the pharmacist and buy these drugs, and they become again important cause of chronic kidney disease. So to highlight again, diabetes and hypertension are the 2 commonest causes of kidney disease, and the growing epidemic of kidney disease across the world and in our country too.
Thank you very much, Vijay. I think your point are very well taken. The whole audience should know today that the commonest predisposing factor for kidney problems in India are hypertension and diabetes is nicely expressed by Dr. Vijay Kher.
हेल्थ, फिटनेस और पोषण पर पाए बेस्ट डॉक्टर्स की राय सिर्फ famhealth.in पर, और हमारी YouTube पेज माय फैम हेल्थ पर सब्सक्राइब करना ना भूलें।